Today, we are going to talk to you about a career as a genetic counselor and the process of becoming a certified genetic counselor. References can be found in the notes for each slide, and a cumulative list can be found at the end of the presentation. As a disclaimer, these slides are purely for educational and recruitment purposes only. None of the information in this slide deck should be considered medical advice. Please talk to your healthcare providers if you have any specific questions. Also, due to the static nature of these slides, please always confirm any statistics or guidelines for the most current data. Do you know who Angelina Jolie is? She's an Academy Award-winning actress and is well known for her roles in Lara Croft Tomb Raider, Mr. and Mrs. Smith, and Maleficent. In 2013, Angelina was in the news because she had a bilateral prophylactic double mastectomy. This means she had both of her breasts removed. This is something genetic counselors handle in the cancer specialty. Angelina's mom died young at 56 after fighting cancer for almost 10 years. There are two genes, BRCA1 and BRCA2, sometimes referenced as BRCA1 and BRCA2, that normally help our bodies prevent cancer. However, we know that there can be changes in these genes that lead to an increased risk for developing certain cancers, including breast, ovarian, prostate, and pancreatic cancer, even male breast cancer. Angelina Jolie has one of these types of changes in the BRCA1 gene. Beyoncé's dad was also found to carry one of these types of changes, but in the BRCA2 gene. The risk for someone assigned female at birth in the United States to develop breast cancer in their lifetime is about 13%. Recent studies indicate that BRCA1 and 2 carriers have up to a 70% chance of developing breast cancer by age 80. That's more than 5 times higher. The risk for ovarian cancer in the general population is less than 2%, while BRCA1 carriers have up to a 50% chance by age 70, and BRCA2 carriers have a 20% chance by age 70. So these BRCA1 and 2 changes significantly increase the risk for someone to develop breast and ovarian cancer, as well as potentially other cancers that we aren't discussing in detail today. Someone learning that they have these increased risks leads to making many difficult decisions. There are several options for surveillance and prevention, and the decisions that are made are unique to each person. Such options might include choosing between more frequent screening, such as mammograms or MRI, preventive chemotherapy or hormone therapy, or surgery to remove the breasts and/or ovaries. These decisions can be difficult to navigate and can take time. Support during this time and process is extremely important. As genetic counselors, we help educate and support people as they go through the process of making these types of decisions. What is genetic counseling? Well, the community of genetic counselors strives to provide genetics information. This includes risk assessment and teaching patients about their risks and options. Support and advocate for patients to promote informed choices and to provide resources. To collaborate with other members of the healthcare team, and to participate in research activities related to medical genetics and genetic counseling. Usually we see these goals in action in direct patient care. However, there are many other settings and roles that genetic counselors can perform to support these professional goals. This presentation will briefly touch on some of these other settings, but more information can be found online if you are interested. Who are genetic counselors? Genetic counselors have advanced training in medical genetics and counseling skills. Genetic counselors can come from a variety of backgrounds, such as biology, genetics, nursing, psychology, public health, and social work, to serve as patient advocates and educators. Next, we'll take a closer look at the roles and responsibilities of a genetic counselor during a session. Imagine a doctor tells a patient that they think they should see a genetic counselor. What are some of the questions the patient might want answered? What would they want the genetic counselor to go over with them? Some potential reasons for referral to genetic counseling could be a family history of cancer or other genetic condition, pregnancy with a suspected birth difference or genetic disorder, or personal symptoms that may have a genetic basis. How a genetic counseling session is set up will change based on the reason for seeing the patient or even the specialty. However, there is a backbone structure that most sessions follow. First, it's important to prepare for the case by collecting information from the patient's chart, researching the condition, and exploring resources and referrals that might be informative. The genetic counselor might want to consult with the healthcare team to learn more about the patient or maybe to better understand a diagnosis. Once the patient has arrived for their appointment, keeping in mind that the structure of the session may change based on the reason the patient is being seen, it is important to collect a personal and family history. Then, the genetic counselor will educate the patient on relevant inheritance patterns, testing options, and provide psychosocial support and counseling. They may also talk about how testing results may impact other family members. Sometimes a patient is receiving a diagnosis, and it's important to talk about management, treatment, and prognosis, while other times it may just be an appointment to talk about testing options. If testing is being done, the genetic counselor would coordinate genetic testing, review results, and discuss them with the patient. Genetic counselors are trained to help patients navigate difficult decisions and support them along the way by providing educational and support resources or referrals. Genetic counselors will tailor each session based on the specific indication and needs of their client. After the session, the genetic counselor might be responsible for writing chart notes or family letters and working with insurance companies to cover costs of testing and provide prior authorization as needed. For example, letters of medical necessity. Genetic counselors can work in a variety of different settings. Some of these can include hospitals, laboratories, universities or genetic counseling programs, nonprofit or government agencies, biotechnology or pharmaceuticals, and government. Genetic counselors that see patients are more likely to be employed by a hospital or other medical setting, while genetic counselors who do not see patients are more likely to be employed by a commercial diagnostic laboratory. Genetic counselors in the lab setting could call out test results and answer questions about the various tests offered at that particular lab. They may also have roles such as writing test reports or interpreting variants, meaning they help classify if new changes found in DNA are harmful or just normal variation. As another example, some genetic counselors design visual aids for patient-facing genetic counselors to use in their clinical roles. While most genetic counselors work full-time, a little under 10% do work part-time, and there can be flexibility in working hours. Most genetic counselors work in a hospital setting and are part of a larger healthcare team. Genetic counselors often work with other allied health professionals, such as non-genetics physicians, for example, maternal fetal medicine doctors or oncologists, geneticists, particularly in the pediatric and adult clinical settings, sonographers, nurses, physical therapists, speech language pathologists, audiologists, dietitians, social workers, occupational therapists, and others. Certain genetic counseling roles are more likely to be in contact with some of these providers than others, depending on the specialty they're in. Let's look at some of the genetic counseling specialties now. There are various areas in which genetic counselors might work. The three most common clinical specialties are prenatal or reproductive genetics, which concerns pregnancy, pediatric, which is about children, and cancer. Prenatal or reproductive genetic counselors might see patients who are already pregnant or wanting to become pregnant, who have an abnormal ultrasound finding are at an increased risk of having a baby with a chromosome difference, or who have a family history of birth differences or a certain genetic condition. They might also see patients for infertility or a history of multiple miscarriages. Pediatric genetic counselors see kids with unique physical features or birth differences, who have had trouble growing, those with learning disabilities or behavioral differences, and kids with a suspected or diagnosed genetic condition. For the cancer specialty, genetic counselors see people who have a personal or family history of cancer or other tumors. Genetic counselors may also work in adult and specialty clinics, such as connective tissue disorders, hematology, cardiology, ophthalmology, and neurology. Genetic counselors can also work in lab, research, education, as a professor or program director, or in administration. There are a wide variety of ways to be a genetic counselor.
So, if you are interested in becoming a genetic counselor, then there are certain steps that you should take to help you on your way. The first two, earning a bachelor degree and doing the required coursework, are required, while the second two, advocacy and exposure to genetic counseling, are highly recommended at most institutions. Application requirements can vary between different programs, but these are the most common expectations. How individual applicants meet these preparation steps might look different from person to person. You should pursue things you're interested in. The biggest thing to show is that you're interested in genetics, dedicated, and that you have enough experience for the program to trust you're ready to dive into complex genetic and psychosocial topics. It is important to keep in mind that biology, chemistry, and organic chemistry are often required to get into genetics and biochemistry courses, and it is often easier to meet these requirements while pursuing a life sciences major. However, this is not a requirement. Many applicants have very different backgrounds or find genetic counseling later in life. Other ways to help prepare include shadowing and or interviewing a genetic counselor, volunteering with a crisis hotline, Planned Parenthood, or shelter, gaining patient advocacy experience, such as volunteering with a local fundraising or awareness event, reviewing prospective student materials publicly available, such as on websites, podcasts, and TED Talks. Keep in mind that requirements often change over time, so it is recommended to regularly check with your programs of interest to be aware of the most up-to-date requirements. To become a genetic counselor, you need to be accepted into an accredited genetic counseling program. Typically, these consist of classes, fieldwork rotations with a supervisor, and a final research project. At the end of your training, you will be eligible to take the board's exam to become a certified genetic counselor, also called a CGC, which is a requirement to practice as a genetic counselor in many jobs and states. Currently, there are more than 50 accredited GC programs in the United States and Canada. Programs typically last 18 to 24 months, and requirements can be structured differently during that time. To find an accredited program near you, visit the Accreditation Council of Genetic Counseling website. There are also programs in other countries, including Australia, the UK, Austria, Italy, and Portugal, accredited by their own organizations. The field of genetic counseling has been growing and is projected to continue to grow. As it does, new positions and roles have and will continue to become available for genetic counselors. Many remote positions have also become available as telegenetics became more widely used due to the COVID-19 pandemic. About 4 out of 5 genetic counselors work remotely in some capacity. The majority of 2023 graduates accepted positions by the end of 2023. The average starting salary for a new graduate in 2023 was just over $81,000, but that was variable depending on location and position type. For example, a starting salary in California is about $100,000 for new graduates, while it may be lower in other areas. In 2023, the average salary for a full-time genetic counselor was over $100,000, though again, this can be variable depending on job type, specialty, and level of experience. After graduating from an accredited genetic counseling program, there are a few steps left to begin a career as a genetic counselor. Most genetic counselors are required to sit for the American Board of Genetic Counseling, or ABGC, board's exam to practice in the United States. These are currently held every August and February and are now offered both in person and online. Passing the boards is the last step in receiving your Certified Genetic Counselor title. Some states also require licensure for their genetic counselors. Applications for licensure typically happen after you pass the board's exam and are certified. Each state has different requirements, so be sure to learn about these before taking a new position. So, is genetic counseling the right career for you? This career blends helping others with teaching genetic concepts. People who enjoy genetic counseling often like teaching, advocating for others, and keeping up with the developments happening in the field of genetics. The field is constantly changing. Genetic counselors typically have a traditional work schedule, Monday through Friday from 8 to 5, and there's also flexibility in the form of part-time positions or work from home options. You might be wondering, do genetic counselors like their jobs? In the professional status survey sent to all genetic counselors in 2024, over 80% responded that they were satisfied or very satisfied with the profession overall. Satisfaction levels are high regardless of position type and have been consistent with past survey responses. If you're interested in learning more about genetic counselors, discuss it with your academic advisor or contact a local genetic counselor for an informational interview. The NSGC webpage has a Find a Genetic Counselor search page with genetic counselors who are willing to set up meetings with people who are interested in the field. You can also reach out to genetic counseling graduate programs or attend informational sessions and open house events. Thank you so much for joining us today. If you have any questions or are looking for further genetics practice, please revisit the UNCG Genetic Counseling website. Thank you.